So hopefully, it's. I think the cost still is concerning for many, and I know there are people who wants to switch, who wants to join, and I and I see opportunities, and hopefully, we can look into those to see. Now, again, with this seamless exchange, I was just checking my notes, and also like the entire clinical data exchange. I think some of these things are going to kind of be resolved on its own, like
Yeah.
because the information is
Yeah.
already there, and probably that's why those EMR companies didn't want to have these things readily available because they would maybe lose business. Now, we kind of maybe I forgot or we I don't know if I missed it, but now we have a new system coming up on the practice management side, and we have a couple different names for it, but Oracle Health Patient Accounting, Patient Administration, Patient Portal. I would like to kind of see how we are doing with those. We are going to be going live with our surgery center on the new system. How is that working out so far? What's going to be available for those who are
Yeah.
already using Oracle and who may want to use Oracle?
Yeah. So when we think about AI, right, we spent a lot of time today talking about the provider experience, patient experience, but that's only part of it. And when we look at healthcare, after the doctor's visit, there is a lot of complexity around billing and getting approvals from insurance companies. So when we think about our approach and the solution, if we're going to tackle healthcare, we can't just do it with the electronic medical record. You really have to go end to end. And if we're trying to reduce friction and abrasion, we have to think about those interactions with the payers as well, right? So let's say you need an authorization from the insurance company. Yes, we're going to pay for this test, and there's a lot of back and forth that you have to go through. And so we believe that we can bring artificial intelligence to all of this, right? So even our financial systems, and it starts with, right now we're seeing AI being used to generate the note, but AI can also be used for coding. So it just autonomously says, here's the codes that we recommend, and of course the doctor has to sign off on it. And then you automate all of the coding and then really automate the submission of the claim, and to be able to work with the insurance companies, whether sometimes they want more data and more information, to electronically retrieve that information. And then if the claim is accepted, great. So you're trying to increase your clean claims.
Right.
The things that we're working on is real-time claims adjudication. If we can kind of clean up and understand all the insurance rules on the front end, then we're saving providers time. We're helping them correct the claim, make sure it's got everything that it needs before it's even submitted, so that it can be adjudicated quickly. And then what's exciting, so essentially on revenue cycle and Oracle Patient Accounting, we're bringing the same kind of approach, right? As much AI as possible, as much automation as possible. And you're going to see that when we talk about the patient portal, right? The patient plays an important part here, whether it's paying co-pays or scheduling appointments. But, patients also want to understand their information and data. So when we talk about the ability to use ambient listening or to be able to use search criteria, we're going to bring all of that to the electronic health record as well. So instead of having to consult GPT or Chat GPT or some of those other AI, it's all sort of embedded into the actual patient portal as well. So that's an exciting uplift that we expect to see. But again, it's just bringing AI across all of it. Some of the things that we're working on with the insurance companies around automated prior authorization. How do we make sure that from the very beginning, you have to do the prior authorization? We can auto-generate the request. And then we're working with the payers to say, okay, if we can bring you this auto-generated, can you help adjudicate it so you can do it more rapidly? And what we're finding is even from the insurance companies is they're anxious to move forward because they want to reduce their own administrative costs. So everybody's looking for savings. I think we're all driving towards creating more efficiency and more automation to reduce these administrative costs.